So if you're an athlete or individual who has been dealing with an ACL injury recently and you're not sure on what you should do for rehab or who you should turn to, I just want to put this video out there in order to help you with your ACL early stage rehab, to getting you feel better and understanding what you should prioritize right now. So really, the rehab for ACL injury should happen almost 2 to 3 days after your ACL injury, and this is very, very important. Most people will wait until after their ACL surgery to then start performing their rehab. But you should really be starting to do your prehab before the surgery to not only improve the range and strength before you go into your surgery, but this will also help with the recovery time after you have performed your ACL surgery. I really recommend you to find a physio around you to help you start with this rehab process and doing conservative treatment with them to really manage the pain, the swelling, and what exercises you should be doing that is tolerable for you. Of course, there are some people who are dead set on for performing the surgery. I'm not against it, but I'll really recommend at least 4 to 12 weeks of firstly trying the conservative treatment, because as mentioned before, this will really help with your strength, your range of motion, and just helping with your recovery process after you've performed the surgery anyways. And really waiting for 8 to 12 weeks after your ACL is torn won't make too much of a difference. And using that time to really allow the swelling to go down a little bit, the pain to kind of dwell down, and work on your strength of the quads, the hamstrings before going into the surgery will actually help with benefiting you much more after you've done or performed the surgery. So of course, performing the surgery is not a must. It really depends on your current situation, whether you're trying to keep playing at a pro level or aiming to be playing at a higher level. And if you are, then you probably want to consider the ACL surgery route, because you'll be probably playing a lot of games. But maybe you're just a casual hooper and maybe you're only playing once or twice a week, then maybe you won't even need to perform the ACL surgery, because I've seen athletes with me, right? They didn't do surgery and they just worked really hard in the gym, in the weight room, to work on their strength, in their quads, their hamstrings. And so it really depends on a few factors of your situation. So within the early stage rehab process of ACL, there will be 5 to 6 things I'll kind of be aware of. And the first thing will definitely be the pain and swelling. The swelling will definitely be there after your ACL surgery or injury, and this is a very normal part of the process, because this is where there will be inflammation to basically try to promote blood flow into it and try to limit some of the ranges of motion, because once there is swelling, it will start to limit your knee flexion and extension and try to protect the area. And this could be there for up to 4 to 8 weeks, and of course there will be some people who will be quicker, and maybe it will be at 2 to 3 weeks, and for some it might be longer, maybe at 10 weeks. But this is completely fine, and every individual is a little bit different, so only compare yourself to you. And this is definitely one of the first things that I'll be addressing along with the pain. And for most times, you're just trying to really maintain your pain to be under a 3 out of 10 intensity when you are performing exercises, and really not trying to push into that pain. So there are 3 things that will really help with the swelling, which are active movements, compression, and elevation. And by using objective metrics like measuring the circumference with measuring tape around your patellar can be a really good way to objectively track your progress of the swelling to see whether it's decreasing from week to week. The second thing is definitely the range of motion. For most people after their ACL surgery, knee flexion is definitely going to be very limited, but the more important one will be knee extension. Why knee extension is so important and hugely emphasized in the ACL rehab process is because this is super important for gait, which means walking. And by missing the full knee extension, you are basically going to prevent quad inhibition. And if not addressed properly, this will lead to regaining extension harder down the line, and could also cause some complications such as cyclops lesion or anterior knee pain. And of course, the next thing will be the knee flexion range of motion. And for most people at around 4 to 6 week mark, the 110 to 120 degrees of knee flexion will be very, very good as a marker. And if you're more than that, congrats, you're doing really, really well. And if you have a little less than that, it's fine, just keep working on it. But maybe if it's down the line at 12 to 16 weeks and it's still missing quite a bit of range there, definitely reach out to your physio and your doctor to consult a little further on what's happening. Maybe there's a complication with it, and it'll be good to address that early. And I'm sure at this point you've seen the Neymar video of his knees being pushed into knee flexion aggressively after his ACL surgery or injury. And you can tell in the video he's in a lot of pain and it's very, very uncomfortable for him. You should definitely do not do that. And this will possibly even cause more complication down the line. And if you have a meniscus injury there, pushing into it could cause a lot of problems. And to help with the range of motion by performing active and passive knee extension and flexion, this will really, really help, along with doing stationary biking, possibly with the seat a little higher so you're not going into too much of a knee flexion, which might aggravate a little bit of pain in your knees. And for the third thing here is going to be strength. And gaining strength, especially in the quads, is going to be super, super crucial. And you're probably wanting to aim for 95% of the strength compared to a non-operative leg. So for most ACL rehab guidelines, they are mentioning about 90%. But what I've learned from Wesley Wang, who's a great ACL therapist who's currently at the States, and you might have seen some of his videos on YouTube or Instagram, he really emphasizes on having an even higher number with 95%, which I do agree with, because when you are changing directions or when you're back into the chaotic nature of sports, there are going to be a lot of unpredictable situations, and having that quad strength there to decel and change direction is going to be essential. And for knee flexion strength, I really want to aim for 90% compared to the non-operative leg, and the knee flexion to knee extension ratio or strength ratio between the quads and the hamstrings, I'll probably try to aim for 80%. So hamstrings should be 80% of the strength compared to your quads. Of course, higher would be better, but that's going to be a mark that I've set out, and it's been doing really well as an objective marker. And if you don't have that device, you can just try to do that on the leg extension machine, maybe trying to push for a number like 6 rep max, right? So maybe trying to do single leg extensions for 6 rep max, and then trying to compare both sides to see what the difference of weight is comparatively. It's not going to be as accurate, but it still will give you a good gauge of where the knee extension or knee flexion strength is. Contrary to popular belief, right, with open and closed chain exercises, they both actually don't have much difference in terms of creating anterior laxity, creating pain and strength, and even patient-reported function. So even in the early stages of rehab, I would have a mixture of both closed chain and open chain exercises. But for example, by doing an open chain exercise like the leg extension or seated hamstring curls, this will isolate the quads or hamstrings a little more because you basically can't compensate with any other muscles. But for example, with a closed chain exercise like a squat, right? Some people, especially after getting injured, they will try to offload the quads by hinging their hips back and not pushing their knees forward, and in order to load the quads. So if you're doing closed chain exercises like the squats, you really want to have some external cue in front of them, such as a foam roller in front of the knees, for them to try to aim to touch in order to get those quads activated and not hinging into the hips. And during this period of time, it's also very important to make sure that you have no quad lags, meaning that your quads are able to achieve the final knee extension range, because as mentioned, it's very important for gait. And I also will, as a bonus tip, I personally have also used EMS and blood flow restriction during this period of time to help with increasing the mind muscle connection, just putting it there to increase signals into the quads, along with blood flow restriction, where I'm just trying to increase the size of the quads and hamstrings as soon as possible. And for the strength portion, I'll be showing you some examples of what exercises you can do right now in order to improve your current situation. And the fourth thing right here will be your gait. So that's basically your walking pattern, and this will be super important on thinking about the hip and knee positions. So let's say, for example, you're trying to get into the hip lock position, which means you're just standing on one leg and your knees are up into hip flexion. This will also accompany with some sort of knee flexion, and this will be super important when you are walking. And by exaggerating movements with hurdles, once able to do so, this will help a lot. And also work on the stance leg with full knee extension. I'll be showing you the exercise later on what you can do. So to start things off, we really want to start getting some ranges of motion into knee flexion and extension. And one I like is just doing it seated, right? And this will be able to get into some passive and active range of motion. So for the passive side, let's say my right knee is the one that is injured at the moment, and to do some seated passive knee extension, you want to use your left leg underneath it, scoop it under, and you're just trying to extend your left leg, which will help with your right knee getting into knee extension. You won't need to use any force in your right leg, just keep it chill, right? And you're just gonna slowly come back. And again, extend your left knee as much as you can and come back. And of course, you can do it with seated assisted flexion as well. So you're now going to put your left leg on top of your right leg. You're going to bring it in gently until the range that is comfortable for you. If you feel like there's pain of more than 3 out of 10, just don't push past the pain. Just maintain it there and slowly come back. And again, and slowly come back. Of course, you can do this with active range of motion as well. So you can just basically straighten out and try to get as much knee flexion as possible. So you're trying to get into knee extension and flexion. Quick interruption here. If you're an athlete who's tired of being injured, slow, and immobile, check out the link in group description below for exclusive access to programs, content, and weekly calls, and you get all that for free. Back to the video. So for the next thing here, it'll be good to start working on your knee extension isometric strength. And you can use a leg extension machine like so, or you can just try to do some straight leg raise on the bed, right? And just try to hold it up and down, hold it up and down, keeping this knee completely straight the entire time. But if you can start loading it, please do. And I'm going to be using a leg extension machine here. So you can do it with both legs, right? You're just going to kick up to around 150 degrees of knee extension, and you're just going to hold that for the allotted amount of time that you desire, which would usually be around maybe 30 to 60 seconds. Of course, if you want to make it a little harder, and this is probably not in the early stage, but more in the mid stage, right? You can just try to go 2 up. You're gonna hold it with 1 leg, and before you come down, you're just gonna come back slowly. So you really don't want to do the single leg version too early on in the rehab because it might aggravate your knee pain. So for now, just stick to 2 legs and just hold it there. And of course, if you don't have a leg extension machine, you can use Spanish squats. So you're just going to find a thick band. You're going to loop it around the back of your knees, right? You're going to give it a little bit of tension, not too much, because right now you could be in the stage of where your knees can feel a little bit aggravated, right? And from here, you just want to sit down as much as you can. You can use hand support if you need to, right? But if you can, just leave it alone, hands free. And you're just going to hold this for the allotted amount of time, maybe 30 to 60 seconds, and you should feel a good quad burn. But for whatever reason, you don't even have a thick band, what you can do is you can just elevate your heels right against the wall. And from here, I just want you to make sure your hips, your upper back is touching the wall along with your heels. And you're just going to slide down, right, just a little bit. And you're just going to hold this for 30 to 60 seconds. And once you're able to do isometrics relatively well with being able to achieve 90 degrees of hip flexion actively, then we can start doing some isotonic movements, meaning that your knee will start to move into extension and flexion. So we can also do this exercise right here, which is the wall hack squats. And from here is basically the same. You're just going to slide down and you're going to come back up. Slide down and come back out. This will really isolate your quads because right now you can't hinge into the hips, which is what I mentioned earlier with being open chain and closed chain exercises. You just really want to dip down into the knees and get out. So this will load the quads preferentially. And of course, we can also do it with the leg extension machine. Just by the way, this leg extension machine is going to be your best friend for probably the next 12 months. So really use it well. You probably hate it at the 6-month mark, but it's going to be one of the best equipments that you can use during this rehab process. So you can, of course, do it with both legs, right? Really going, no need to go into full knee extension, right? Just probably around here. And then I just want you to slowly control down. You're just gonna slowly control up, right? Or you can explode up and then control down, depending on what stage of rehab or how the pain and swelling is for your knee at the moment. And after you do double leg, right, you're feeling pretty well, right? You can also do what I like is the 2 up, 1 down variation. So right now, just really focus on that leg extension strength. And if you can, try to load the right leg a little more, right? With minimal assistance from the left leg, just trying to assist it. So then you can try to get more of that quad activation for the injured leg. And of course, once you're able to, you can just do it single leg, right? Which will be much more loading onto the quads and knee. And of course, other than the knee extension strength that we need to work on, we also will need to not neglect the abduction, so the glutes. So 2 variations that I really like in the early stage, which will be firstly the side lying hip abduction. So you're just gonna put your elbows right underneath your shoulders, and from here, this leg is forward. You're just gonna keep this leg straight, right? And you're just gonna lift it up and down, lift it up and down. Just really, really controlling that. And you'll probably feel a good glute burn or the glute medius burn right here when you're doing these abduction. And of course, this could be done on the operated and non-operated leg, or the non-injured and injured leg. And another variation that I like is the side plank hip abduction. This will really depend whether your knee is able to tolerate it, but if it's able to, I really enjoy it. So from here, you're just going to get to the sides. Because of the knee being compressed, it might feel a little too much, but if you feel like it's a lot, you can just keep your knees and hips on the floor. And from here, you just want to keep this leg bent, right? And you're just gonna lift it up and down, lift it up and down. Side plank, and then you can lift this up and down. So this will really, really work on the glutes on the top leg. And of course, bottom leg when you're isometrically holding it. And finally, you might think that I forgot, but I didn't, which is knee flexion, which is hamstring strength. And for this, right, you can basically get a foam roller. And what you want to do is just put your forefoot on to the foam roller, right? If you want to make it easier, you can find something here, such as a wall, to kind of push against it. So it's going to be easier and less loading on the hamstrings and calves. But for now, let's just say we're going to do this version, right? And this will be a progression to this being against the wall, right? And just holding it there, which will also require less stability. Have your knees at around 90 to 120 degrees of knee extension. You don't want to be way too close because this will be too much for the hamstrings and your knee probably won't have the range. Around 90 to 120 degrees will get a good contraction of the hamstrings. You're just going to lie down and you're just going to push your foot down, right? And then lift your hips up just a little bit, okay? And you're just going to hold this isometrically for the maybe 30 to 60 seconds, right? This will really activate those hamstrings and getting your calves working as well. So there's a variation that I really like, just some isometric holds, super, super simple, but able to activate your posterior chain really well. Before this, just make sure that your hips are only half an inch up and only allowing a credit card to slide through. And after doing isometrics, of course, you can do it with hip thrust as well. So you can do it on the bed, you can do it on the floor, it doesn't really matter. And for here, you just want your knees to be at around 90 degrees. And what you're wanting to do is you want your foot to be completely flat, and then you're just gonna lift your hips up and down. So this will really work on the hips and glutes, of course, along with your hamstrings without pushing into the knee flexion range that you currently do not have. And I know that this is a super, super long YouTube video to watch, and I'm super grateful that you've stayed almost till the end. I've got 2 more things to kind of discuss, but I just want to share with you my Skool community, which is completely for free and within the group description below. And there's basically going to be strength programs, mobility programs, and of course some ACL stuff for you to work on to help with your rehab at the moment. And there's also other athletes within it. So if you need further help, please go there and check it out. But the last two things that I really want to discuss is that I don't want you to just stop doing anything. So there's a very, very easy time to get deconditioned, and most people will just completely rest before and after the surgery, which will actually lead to much harder recovery times afterwards and making a comeback into your sport or returning to sport. And during this period of time, you might be thinking, what can I do, right? The exercise just now, those could be done, all bilaterally. So that might be done after the surgery. But because your other leg is completely fine, let's say before the surgery, you can basically do some single leg presses. You can do some single leg calf raise. You can do some pistol squats if you can, right? Maybe single leg box squats. Just try to do as much single leg stuff possible, right? Because there is something which is called the cross education effect, which means that by training one side of the body, there is going to be transfer of maintaining and improving the strength of the other limb. And of course, not just the legs. I mean, your upper body is completely fine. So please just maybe go do some push-ups, do some flat dumbbell presses, incline dumbbell press, shoulder press, maybe some chin-ups, whatever, all right? Because ultimately, I don't want your body to feel deconditioned and making the rehab process much harder after the surgery if you do decide to go with it. And going on to the final thing is going to be psychology. I know that this is a super, super difficult time for you to go through. It's very, very frustrating with an injury like this. And this could be stopping your career from going forward to playing at the pro level or even playing at college or high school, to getting you exposure to the public on what player you are. But most people will try to rush it at the 9th-month mark and try to get back to playing 5-on-5. And what I've seen from online is that most people will be having another ACL surgery on the same side or on the other side. If you really do the rehab and strength conditioning well, you might be a better player than you were before, because before your surgery or injury, you were not doing any of these, right? And now that you have the foundation and baseline for it, you might be bouncing back as the better player than you were. You might be more athletic. This is very, very possible. And I've seen athletes who have worked with me doing that. And that being said, please just share your frustrations and emotions with your family, your friends, or your therapist, because we know that it's very difficult. We know that, even me as an athlete, I know that injuries are super frustrating and it's not fun at all. But if you really don't have anyone to turn to and you want to have other athletes or like-minded athletes to understand what you're going through right now, you can check out the group description below for my free Skool community, which is basically the gains chamber, which allows and helps athletes like yourself to go through that mental hump and also just trying to break through their own performance. Everyone's on a little different journey. Some might be trying to improve their strength. Some might be trying to get more athletic. Some are trying to get more size. And for you, some might be just trying to get through their injury and becoming back to their normal self. So if you're interested in it, please click the link below in this group description, and I'll be in there to get support from me, and I'll see you on the inside.